Thank you for the invitation to present. It's an honor to be here, and yes, it's quite late, so I hope you'll forgive me if I don't stick around for the full session. I'm presenting on behalf of a team of researchers here in Canada who have come together over the past 3 years to mobilize a program of research specifically in response to conversion therapy. So let me start with some definitions. So what we're talking about here is a fairly poorly defined set of practices, but that have one common characteristic, which is that they work to suppress same-sex attraction, or they work to discourage patients from expressing gender identities that are discordant with the sex assigned at birth. Now, we know that there are more than 50 health professional organizations, for example, the American Medical Association, the American Psychological Association, et cetera, that have issued consensus statements denouncing conversion therapy. And this is owing to empirical evidence that shows that these practices are associated with poor health outcomes. I'm showing a statistic here from a study that we've conducted in Canada, where we find that 1/3 of those who went to conversion therapy attempted suicide at least once. But despite these denouncements, we know from a number of surveys, which I'll show you in a moment, that conversion therapy continues to happen in Canada and in comparable societies around the world. We estimate that about 10% of lesbian, gay, bisexual, transgender, queer, and two-spirit people in Canada have experienced it. The problem that we're contending with right now is that the popular concept of conversion therapy is really quite narrow. So I'm showing one older film and two more recent films that paint a really particular kind of picture of conversion therapy. And in fact, what we're seeing from the research is that conversion therapy practices are much more diverse than what you would be left believing based on these films. So an interesting policy window has opened here in Canada. In the fall of 2019, our Prime Minister mandated that the Minister of Justice and the Minister of Diversity, Inclusion and Youth develop a federal bill to ban conversion therapy. And this bill has gone through quite the roller coaster. It was introduced in March of 2020, the week before our parliament closed due to the COVID-19 pandemic. They then reintroduced the bill when parliament opened last October. The bill made its way through committee study. It passed our House of Commons, but unfortunately did not reach a final vote in the Senate before our Prime Minister called an election this summer. We have now heard from the government that the same party, the Liberal Party, has been elected to form a minority government, and we have heard from them that banning conversion therapy is a priority of theirs. So we're now taking the research that I'm about to show you and trying to create some recommendations for the new bill that will be introduced this fall. So our study is known as the Unicorn Study. We look at a variety of different environments where sexual and gender minorities will find their identities affirmed or denied. And the questions that we've been asking through this research program are how prevalent are conversion therapy practices? What's the nature of contemporary conversion therapy? And by that, I mean, what forms does it take? What settings is it happening in? What ages are experiencing conversion therapy? And then finally, what can be done to prevent it? So I'm going to show you some highlights from a few different studies, quantitative and qualitative, that we've run in Canada here over the last few years. I'm including here a few of the publications that we have used to help policymakers get to an empirical understanding of what conversion therapy looks like, rather than relying on those stereotypes that come from Hollywood films. So first, let me share with you what we know about the prevalence of conversion therapy in Canada. We have had 3 surveys, national surveys, bilingual, French and English, conducted over the past 10 years that have included some measure of conversion therapy. Now you can see in this column where it says definition that this is part of the problem, the root of a lot of our problems around intervening in conversion therapy. There's lots of different definitions and lots of different terms that are used to describe this. But based on these surveys, we have a crude sense that it's somewhere between 4 and 11% of sexual and gender minorities who have experienced conversion therapy. Now, this is not an even distribution throughout the sexual and gender minority population. We note in our most recent survey that in particular, non-binary and transgender people are much more likely to have experienced conversion therapy, as are young people, immigrants, and racial minorities or indigenous people. All of these groups show prevalence of conversion therapy closer to the 15 to 20% mark. We are also very interested in the geography of conversion therapy. Canada is a large country with really very diverse social and political ideologies. We do see, so in this choropleth map, the darker shading indicates more conversion therapy practices identified. This is from a survey of about 100 people in Canada, and we asked them to tell us where they know of conversion therapy that's still being offered. So we do see a little bit of a west-east gradient. So I'm joining you from over here on the west coast of Canada, and it does appear that the western provinces and territories seem to have more identified conversion therapy practitioners than out east. Perhaps also some higher prevalence of conversion therapy in the maritime provinces. And this really mirrors, this is a publication from Jack Turbin's group in the United States, and they have also shown in their surveys from the 2015 US Transgender Health Survey that there is also a phenomenon not entirely understood, but we do tend to see more of these practices happening in the western part of the countries. So the next question we had is, what forms do conversion therapy practices take? And we derived this information from 22 interviews we did with people in Canada who had experienced conversion therapy directly. And what you can see here is that there's really not any one consistent modality or form of offering these practices. It's really all over the map. In most cases, these are discredited, we would probably say pseudoscientific practices. I do want to highlight one that stood out to us, which is that when we interviewed some transgender individuals who had gone through conversion therapy, really where that started to come up for them was when they sought gender affirming care and unfortunately got connected to a primary healthcare provider or psychologist who was ideologically opposed to transgender identities and therefore served to stop those individuals from accessing gender affirming care, including hormone therapy. So consistent with that popular narrative, the kinds of things you would get from movies like Boy Erased, we do see from the most recent national survey that about 2/3 of the people who've experienced conversion therapy went to these practices in a religious or faith-based setting, primarily Christian settings, although not exclusively. But there are still 30%, so nearly 1/3, who experience conversion therapy in licensed healthcare provider offices. And what this tells us is that the regulations that a lot of the health professional bodies in Canada have passed are not being enforced. There's still pockets of healthcare where conversion practices continue to occur. And my colleague Florence Ashley, who's a legal scholar here in Canada, has written a lot about trans conversion therapy or reparative therapy, and explained that in fact, because transphobic attitudes remain more common than homophobic attitudes today, we continue to see instances where transgender people are unfortunately experiencing conversion practices in licensed healthcare settings. In the survey with people who had had direct experience, we asked about the age when they started conversion therapy, and there is a very clear peak right here at the median age of 18. Now, that doesn't mean that conversion therapy doesn't happen in adulthood. Of course, we see it, but there seems to be a critical window that is probably a few years after the median age of coming out for other LGBTQ people. So this brings me to the bill that was introduced, and I've included for you here the definition of conversion therapy that that the Federal Liberal Party proposed. Our take is generally that this definition is quite narrow, and that is perhaps appropriate because the mechanism for this bill is to make it a crime. It's part of the criminal code, but there's some problems with interpreting this. So they've defined conversion therapy as a practice, treatment, or service designed to change a person's sexual orientation to heterosexual, or gender identity to cisgender, or to repress or reduce non-heterosexual attraction or sexual behavior. And then there's a for greater certainty clause that is meant to ensure that this isn't misinterpreted to stop trans people from accessing gender transition related care. So we did ask those survey respondents, just over 174 of whom who experienced conversion therapy directly, if that definition that I just showed you from Bill C6, if it corresponded to their experience. And unfortunately, 50% said that the conversion therapy they experienced wouldn't have been prevented by the bill. And there's two major reasons for that. One was patients who said that the conversion therapy they experienced happened as part of a trans healthcare program. And the second was really a common point of feedback, which is that conversion therapy wasn't formal and it wasn't called conversion therapy. So this person said that actually it was prayer groups, exorcisms that were described as practices to help guide a pursuit for purity or a pursuit for godliness, not really about getting rid of the gay as much as it is aligning behaviors and practices with particular religious ideology. So in this context, we've moved from talking exclusively about conversion therapy, which we think is really just the tip of a pyramid. And underneath conversion therapy, we have something that we've called sexual orientation and gender identity and expression change efforts. So whereas conversion therapy would be a more circumscribed program, for instance, show up at this group, at this center every week for 12 weeks, and we'll take you through a structured program. SOGIS would be more like conversations, for instance, between a religious leader and a young person, between a coach and an athlete. These kinds of conversations that are sometimes gently, sometimes more forcefully discouraging a diverse sexual or gender identity. And one thing I want to point out here is that during COVID, we saw a real increase in venues where SOGIs are being offered online, either through apps or through Zoom meetings or other discussion groups. And of course, when we talk about this, we like to remind people that all of these practices, conversion therapy and SOGIs, are really held up by pervasive societal beliefs that privilege cisgender and heterosexual identities above all others. I don't expect that our federal politicians are going to take me up on this, but I've tried to do some writing for the sake of public education to explain that, in fact, the more we pick apart conversion practices, the more we see that the defining feature of conversion therapy is not an attempt to convert or change some intrinsic gender or sexual orientation. Rather, the defining feature is the goal of avoiding acceptance and acknowledgement of LGBTQ2 lives as compatible with being happy and healthy. And the reason we think this is important is because if we continue to have a very narrow concept of conversion therapy, we will get rid of the top of that pyramid, but we'll do nothing to actually address the underlying societal values. So these are the strategies that we've proposed. First and foremost, we believe that we need more structured support for survivors. We estimate that there are more than 50,000 people in Canada who are currently dealing with the trauma of having been through conversion therapy. And we believe that our governments have a role in providing remedial supports and trauma-informed care. Yes, we want legislative bans at multiple levels of government, but we also want to see more active regulatory enforcement. And going back to that pyramid, what I would really like to work on is how do we do better engagement with institutions, organizations that were previously condoning conversion therapy? How do we create supportive LGBTQ affirming environments? And I'm giving you an example here of one initiative that we've worked on here in my province of British Columbia, which is a mental health service finder tool that helps people distinguish between mental health providers who are LGBTQ affirming and those that are otherwise denying the validity of those identities. If you want to follow along with the story of our federal bill, this is a conversion therapy survivor that I work quite closely with, Erica Muse. Erica and I gave an interview to CBC Radio this past summer where we talked about kind of the ups and downs of the bill. And so I've included a link here to that 7-minute clip. I'll end just by thanking the conversion therapy survivors that I work with, my students at Simon Fraser University and other institutions here in Canada, and our team of fabulous collaborators without whom this work wouldn't be possible. So thank you for your time, and I'm happy to take questions if there are any.